Okay, picture this. You walk into a doctor's office with a nasty, chronic cough, and instead of writing a prescription for medicine, he just hands you a cigarette. I know, it sounds completely insane today, right? But less than 100 years ago, that wasn't malpractice, it was actually a recommended treatment. So let's dive into this unbelievable piece of medical history.
So, you've got to ask, how could something we all now know is so deadly have ever been seen as a cure? Was this a genuine, good faith attempt to help people feel better, or was it something way more dangerous just hiding in plain sight? To really get this, we have to rewind the clock. We're going back to the early 20th century. At that time, things like asthma and chronic coughs were super common, but the science to really understand them? Well, it was basically in its infancy. Doctors were pretty much scrambling, desperate for anything that could give their patients even a little bit of relief.
And so, by the 1930s, it was totally normal for your trusted family doctor to suggest smoking to soothe a cough or make it easier to breathe. And I want to be clear, this wasn't some fringe idea from a quack doctor. This was mainstream, accepted medical advice, all based on what little they could observe at the time.
So what on earth were these doctors seeing that led them to this deeply flawed conclusion? This is where the story gets really wild. See, they weren't just making it up. They were observing a real physical effect happening in their patients.
What they were witnessing has a medical name: temporary bronchodilation. To put it simply, the nicotine in the tobacco smoke actually causes the muscles around your airways to relax for a little while. And that creates this fleeting, temporary feeling of your airways opening up, making it feel easier to breathe.
And here's the dangerous gap between what they saw and what was really happening. On the surface, doctors saw airways that seemed to open up, but really it was just nicotine relaxing the muscles. They saw their patients breathing easier, but they couldn't see the delicate lung tissue getting destroyed with every puff. The cough might have calmed down for a minute, but a silent, damaging inflammation was building up inside.
Now, of course, this flawed medical idea didn't just stay in the clinic. The tobacco industry saw a golden opportunity. They pounced on this misunderstanding and turned it into one of the most powerful and deceptive marketing campaigns in history.
And this was their masterstroke. This one little phrase, recommended by physicians. It appeared in countless ads, creating this incredibly powerful illusion of safety and trust. I mean, think about it. If your doctor says it's okay, how could it possibly be bad for you? It was simple, it was persuasive, and it was an incredibly dangerous lie.
And the industry went all in. You had these ads with smiling, confident-looking doctors. You had cigarettes being sold in pharmacies, right on the shelf next to actual medicine. They were marketed specifically for things like asthma and throat irritation. The whole point was to completely blur the line between a dangerous habit and a legitimate health product. And man, did it work.
And you've got to understand, this wasn't just some brief fad. It was a strategy that lasted for decades. It starts in the 20s. Then in the 30s, it really heats up as all the big brands start fighting over who has more doctor recommendations. It hit its absolute peak in the 40s. It wasn't until the 1950s that real, hard science finally started to punch through that wall of marketing.
So this whole campaign, this entire illusion, was building towards a public health disaster of epic proportions. That short-term feeling of relief was hiding a truly terrifying reality. And eventually, the truth just couldn't be ignored anymore.
And this right here is the absolute core of the mistake. The entire medical community, with a huge push from a powerful industry, confused a temporary feeling, relief, with actual long-term healing. They were treating a symptom while making the underlying disease so much worse.
There's really no better way to put it. This analogy just perfectly captures the horrifying irony of the whole situation. Every single cigarette that was prescribed to help someone's lungs was actually just accelerating their destruction. It was the worst possible treatment disguised as a cure.
And when the definitive science finally came out, the results were devastating. This so-called cure for a cough was found to be a direct cause of chronic bronchitis, of heart disease, of respiratory failure, and of course, lung cancer. The very things doctors were trying to help were being caused by their own prescription.
So, after all that, what can we take away from this really dark chapter in medicine? Because this story isn't just a shocking piece of trivia. It holds a verdict from history that is just as relevant for us today as it was back then. The cost of this mistake, you can measure it in one single tragic word: millions. Millions of people who got addicted, millions who became seriously ill, and millions of lives that were lost, all because they trusted what was supposed to be expert guidance.
So the first lesson is a pretty humbling one. Even the most trusted professionals with the very best intentions can be catastrophically wrong, especially when the science isn't all there yet and you have powerful industries pushing a certain narrative.
And the second lesson here is absolutely crucial for all of us. Just because something makes you feel better in the moment doesn't mean it's actually fixing the problem. Knowing the difference between temporary relief and a true cure, well, that's a timeless challenge.
And all of that leaves us with one final and honestly pretty chilling question. It's so easy for us to look back now and see how wrong they were, but it forces us to ask ourselves, what widely accepted, seemingly harmless solution do we all trust today that future generations might look back on with the exact same disbelief?